So today we're talking all about mommy makeovers. Now, what exactly is a mommy makeover? Well, it's some of the things that we can do as plastic surgeons to help you correct some of those changes that are not going to be reversible that happen during pregnancy. Those things include the body and the breast most commonly, but there can be other things that we can do as well. In the breast, due to hormonal changes and enlargement due to breastfeeding, sometimes you get some skin stretch and hang to the breast that doesn't necessarily rebound the way that you might want it to. In the body, you get things like stretching of the abdominal muscles and stretching of the skin that also might not rebound the way that you want them to. After pregnancy, we usually give a period of about 3 to 6 months, depending on the procedures that you want, in order for your skin and tissues to rebound fully on their own before we go and do surgery on them. I'll talk about some of the more common procedures that we do during a mommy makeover, but we'll also add in some of the other procedures that we can add on as well. At our practice, we commonly do mommy makeovers as a large procedure that's a combination of multiple things, but that's not always the case. We'll do as much as we can safely, and at our practice, we do have the ability to do a lot of procedures together because we've got surgeons who are well trained in what we do. We've got anesthesia providers who are really good and they do our procedures for us and they know exactly how our surgeries are going to go. We've also got overnight capabilities, and those things are really important in order to do these big procedures. With the breasts, often we'll be doing a lift procedure, and that's to get things restored to their more youthful appearance and correct some of that stretched skin. And depending on the volume goals that you have or the volume that you started with before the procedure, we might also do a volume procedure, meaning a reduction to get rid of some of the volume, or things like an implant to add more volume and projection, as well as that upper pole fullness that some women desire. Or we can do things for some smaller volume additions like fat transfer to the breasts. A breast lift is not always required. Some women just don't get that stretch to the skin or their skin rebounds a lot nicer, but we'll figure out the procedures that you need to help accomplish your goals. For the body, and when I talk about body, what I'm really talking about is the tummy area. Some of the changes that occur are the stretching of the ab muscles, and there's a tissue between them that stretches and doesn't really always rebound as well. And that can cause some roundness to the tummy. I could remove every bit of fat and skin from the tummy, but if you've got a separation there that we don't correct, there's still gonna be some roundness to that tummy. And that's something that can be addressed with a tummy tuck. The other thing that happens is we get some skin stretch similar to the breast. And it's like if you were gonna blow up a balloon really big, just like what happens with pregnancy because you're growing a human inside you. You get some stretch to the skin and you can blow that balloon up and let it go and it'll rebound some, but it may not rebound back all the way to as small as it once was. And depending on the amount of skin that you have that's stretched, the tummy tuck is also a really great procedure for that because we can actually cut out all of that extra skin and pull things tight again. My preference for most people is to do liposuction in addition to the tummy tuck as well. Liposuction, although it's removing fat, is not really a fat loss procedure. It does remove the fat, but what I like to use it for is really for that contouring to dial in those lines and make sure that we're getting really great contouring all around the body. What we don't want to do is have a really flat tummy from the tummy tuck, but not address the rest of the body, and then everything doesn't look cohesive together. Not everybody needs a tummy tuck of the waist area, and it really just depends on your goals and how your skin has reacted to the changes from pregnancy. If you've got just a little bit of loose skin, maybe some stubborn areas of fat, you didn't have a big muscle separation, or you rebounded really well, we can do things that are a little bit less invasive, like just liposuction alone or liposuction with some skin tightening procedures like Body Tight. There are some limitations to not doing the tummy tuck, and that really just involves that we can't remove as much skin and get things pulled as tight, and we can't correct any of that muscle separation. So you may still have a little bit of roundness if you have just a little bit of a muscle separation. Now, if you do need that tummy tuck, there's varying degrees of how big we have to make that scar. What we don't want to do is make the scar too small just to save some length to the scar, but then you end up with kind of a funny shape. We're not actually correcting everything that we need to correct. What we also don't want to do is just make a big long scar just to make a big long scar. So we'll figure out which procedure you need, and whether that's a mini tummy tuck that's a little bit shorter of a scar, if you don't have a ton of extra skin, but you really do need that muscle separation fixed. A standard tummy tuck is good for people who have just kind of a central abdomen loose skin and not a lot of loose skin that wraps around to the sides and the back. With that, we can also correct that muscle separation. And if you've got loose skin that wraps around to the sides or even to the back, we can do things like an extended tummy tuck or even a circumferential tummy tuck that brings the scar around a little bit farther. But if that's what you need to really get that contour, that's what you're gonna want. It's just extending that scar a little bit, but you'll get the shape that you want out of this. All of these procedures are trade-offs for scars. But what's important is to go to somebody who's well-trained and who has done a lot of this, because what I try and do is try and hide that scar in a really low area and that's easy to conceal. Now, everybody's scars will settle and heal a little bit differently, and part of that's about what I do, but part of that's about genetics. But we try and keep it in an area that's easy to conceal in a garment, bra, bathing suit, any sort of pants that you might wear. And importantly, you're gonna look really good in your clothes, especially. What we want is for you to be able to look good out of your clothes or in clothes that are revealing as well. Other areas that may see changes during pregnancy are areas like the arms and the legs, or even the butt, where you can get some volume increase during the pregnancy, and then when the pregnancy is done, you lose a little bit of that weight and the skin might have stretched, or there might just be some stubborn fat that won't go away, or in the butt, you might have lost a little bit of that volume that you used to have. In the arms, we can do things like a brachioplasty or removal of the extra arm skin, or even liposuction and body tighten in those areas. And the same thing in the legs. We can remove skin, we can remove fat, we can tighten the skin up a little bit. And any of these areas that we're taking the fat from, if you need a little bit of enhancement to the butt or a little bit of that pop back, we can do fat transfer to the butt, or what's also sometimes known as a Brazilian butt lift. And here at North Texas Plastic Surgery, we're well known for doing these big mommy makeover procedures often all at once, but that doesn't mean that that's the right procedure in everybody. It's really just about safety. And if we do recommend that you need multiple procedures, it's not because we want you to have 2 surgeries or 3 surgeries or sometimes even more surgeries. It's really all about safety and how to get you that final result that you want. And there's often, other than just safety, a lot of other benefits to doing stage procedures as well that we can go over with you during your consultation. In addition to the surgeries that we're going to talk about at your consultation, there's also some other things that we'll go over that are important that can really enhance your results, and that's continuing to stay in shape, be healthy after surgery, and really take care of yourself. Those are only going to enhance your results in the long term. Now, it's called a mommy makeover because the moms are the most common group of people that we see come in with this group of problems that they want corrected, but it can also happen in other people who have gained some weight and then lost it. Similar changes can occur. I'm Dr. Jeremy Bosworth. If this mommy makeover sounds like something that you might be interested in, visit some of my social media pages to see some of the results, and then visit our website or send me a message on that social media to schedule your complimentary consultation.